Councilors. For the record, Dr. Alan Melnick, I'm the Public Health Director and Health Officer. So the Director's report is an update on our follow-up to the board resolution declaring racism a public health crisis, and wanted to give you an update on our anti-racism transformation work to date. So we last updated you. It's been a while. It's been since last October. And last October, we presented the framework that we're applying to this work, and it includes the 5 steps that I'm going to go over with you briefly today on the document in front of you. At that time, we shared our historical work and current work, as well as next steps. And since last October, we've made some progress on anticipated next steps that we're going to share with you today, including, as we move through the update, a key component of this work is our community health assessment and improvement planning process. So we like to call it the CHA-CHIP, or Community Health Assessment, Community Health Improvement, and that's currently underway. And after my director's report here, we'll have a presentation on that work. Lindsay Schenkel, who I'll introduce as our Strategic Initiatives Coordinator, will be presenting that along with some of our community partners. I'm going to try to go quickly because I want to give enough time for the presentation. So step 1, and if you look at the purple column on the right, it basically summarizes, on the document in front of you, it summarizes the purple column in the progress report as well I'll be talking about. So in terms of step 1, publicly assert that racism is a public health crisis affecting our entire society. That's some of that is included in our the work we're doing on our CHIP. Step 2 of that 5-step process was to allocate adequate financial and human resources to accomplish all the selected activities in our ongoing work. So part of that was onboarding a deputy director, Roxanne Wolf, who came on in December 2022 to help shepherd that process. We're also pivoting to department level equity work, and we intend to bring forward an RFP for a racial equity contractor or consultant to support our work in this area. And we've also done some work, public health grants and contracts, to pilot a contract process to support community engagement efforts. And that includes the project work around the 4th plane and also through the CHA in the CHIP. And we've heard from at least, I believe from at least one other county department about interest in replicating that process. Where step 3 was to create a plan that can serve as a roadmap and a mechanism for accountability, including regular reporting back to the community. And next month, we plan to come to the council for approval for use of additional foundational public health services funding that will include a racial equity director position to help shepherd, coordinate equity work within the department. And we're also intend to bring forward the RFP that I already mentioned, a request to do an RFP for that a racial equity contractor to help do that work. We also purchased a membership to the Government Alliance on Race and Equity. It's also known as GARE or GARE. All of our staff have access to resources, tools, and forums with other government agencies that are also members of GARE. Step 3 was to create a plan that can serve as a roadmap and a mechanism for accountability. This is the external work. The step 2 was the internal work. This is the external work in terms of creating a plan, including regular reporting back to the community. We'll have some additional information on our progress during today's CHA and the CHIP. We're working on developing contract for a public-facing anti-racism webpage. and we onboarded a senior policy analyst in December of 2022, and her scope of work includes supporting our FAC, our internal policy work and legislative agenda planning to support these efforts. And then the racial equity director will seek approval to use additional state foundational public health services funding, because this is considered foundational public health services work, to implement equity work in partnership with our community. Step 4 was to design specific interventions, especially focused on economic determinants of health, such as wealth building. We presented the Raising Clark County project at the May 24th Board of Health meeting, and the findings from that project, as well as findings from our community health assessment and other program areas, will result in recommendations that we'll bring forward for policy and program interventions to improve and address the social determinants of health in Clark County. We're also supporting community planning and applying a health equity lens to the comprehensive plan update. And then step 5 is to monitor and assess impact transparently and regularly. So we're going to be touching on this topic again in the CHA and the CHIP presentation, and we plan as you know, with the FPHS funding available from the state, we plan to request council approval for additional state FPHS funding to add capacity around anti-racist policy development. So we look forward to continuing to share the progress we're making on this work and how we're using additional state foundational public health services funding, including the RFP that we'll be asking for to support our department's racial equity work. So that's what I'm happy to answer questions, or maybe afterwards, after the Public Health in Action presentation, whatever works for all you. That was my director's report.
Anyone on the council have questions for Dr. Melnick on his report? Michelle? I'm sorry, Sue.
Thank you. I would be interested in hearing more about the comp plan update equity lens that you're going to be applying. So whenever you have more information about that, I'd be interested in learning more.
We will be delighted to bring that back to you, Councilor Belkot.
I have a question.
Please, go ahead.
Since I'm a somewhat newer counselor and I don't have some of the back history on this, how was this crisis measured in Clark County in particular? Like how was this data developed?
Yeah, great question, Councilor Belkot. And I'm sorry, I think that was Councilor Marshall I was responding to earlier, so I apologize on that. Yeah, we put together, and I can get the data. Basically, if you look at a variety of health outcomes, there are disparities, and the health outcomes are significant differences between BIPOC populations and white populations, and that's true nationally, but it's also true in Clark County. And some of them are related to the social determinants of health, including longstanding issues around housing, neighborhood conditions. So we presented that back in, and I can resurrect the document for you. It's actually on the website, I believe. When the resolution was passed in December 20, we presented a lot of data around disparities, particularly in health outcomes for BIPOC populations, including in Clark County.
Okay, and you said that information's available on the December 2020 count?
I believe the same. I should have dredged it up this morning. I apologize, but when the board passed the resolution, yeah, we presented. We have a document that describes the that basically provides data as to why why racism is a public health crisis in Clark County as well as elsewhere.
Go all the way up.
Okay, thank you, Dr.
And then
Melnick.
right there, tell,
And if my staff have access to it, I don't have it in front of me right now, but I can be happy to share it. And
Yeah,
that's what
that would
led
be-
to the board, the Board of Health passing that resolution.
Yeah, that would be great. Thank you so much.
Okay, hearing no further questions. Dr. Melnick, were you going to introduce the?
Yes, I was, and I just
Okay.
wanted to add one other thing. I apologize. One of the issues we're addressing, the social determinants of health around this, is that there are a number of conditions, including wealth inequities, housing inequities that lead to these poor outcomes in BIPOC and poor health outcomes in BIPOC populations. So that's part of the presentation we gave back when, and we'll be happy to bring that forward again. Some of this information is in our CHA chip as well.